नर्सिंग विद विनोद सर यूट्यूब चैनल में आपका स्वागत है। आज हम हेपरिन ब्लड थिनर एंटीकोएगुलेंट पर दिलचस्प तथ्यों पर ध्यान केंद्रित करेंगे। हिस्ट्री एंड सोर्स। Heparin is an anticoagulant that prevents the formation of blood clots. It is also known as blood thinner. It was extracted from liver. Heparin is obtained from lungs and intestinal mucosa. Heparin is released from mast cells during anaphylactic shock. Heparin was first discovered by J. MacLean and William Henry Howell in 1916. Drug classification of heparin. Therapeutic class is anticoagulants. Pharmacologic class is antithrombotics. Types of heparin. Unfractionated heparin, UFH, also known as standard heparin. Low molecular weight heparin, LMWA. UFH is given for or subcutaneous. Rapid onset and clearance. It is safest in renal failure. LMWH is given subcutaneously, and the example is enoxaparin, dalteparin, tinzaparin are effective in preventing deep vein thrombosis and pulmonary emboli in people at high risk. Indications and therapeutic effects. Acute coronary syndrome, for example, STEMI. Deep vein thrombosis, DVT. Pulmonary embolism, PE. Atrial fibrillation. ECMO circuit for extracorporeal life support. Atrial fibrillation. TIA, transient ischemic attack. CAD, coronary artery disease. Stroke. Certain types of surgery. Kidney dialysis. Precautions. Bleeding. Hepatic or renal impairment. Pregnancy and breastfeeding. Elderly patients. Ulcer disease. Contraindication. Hypersensitivity. Active bleeding. Severe thrombocytopenia. Uncontrolled hypertension. Drug interactions. Heparin is a common medication used to prevent blood clots, but it can interact with other drugs, leading to potential complications. Aspirin and other NSAIDs. Taking heparin with nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, or naproxen can increase the risk of bleeding. Warfarin and other anticoagulants. Combining heparin with other blood-thinning medications such as clopidogrel can also increase the risk of bleeding and can be particularly dangerous in individuals with certain medical conditions. Thrombolytic agents. Thrombolytic agents, such as streptokinase or alteplase, can increase the risk of bleeding when used with heparin. Digoxin. Heparin can increase the level of digoxin in the blood, which can lead to potentially dangerous side effects. Antibiotics. Certain antibiotics, such as tetracyclines, can decrease the effectiveness of heparin. Drug natural products. While heparin can be an effective medication for preventing blood clots, certain natural products can interact with heparin and cause potential complications. Some of the natural products that can interact with heparin include 1. Garlic. Garlic is a natural product that can reduce blood clotting, which can be potentially dangerous when used with heparin. 2. Ginkgo biloba. Ginkgo biloba is a natural supplement that can increase the risk of bleeding when used with heparin. 3. Vitamin E. Vitamin E is a natural supplement that can increase the risk of bleeding when used with heparin. 4. Omega-3 fatty acids. Omega-3 fatty acids, such as those found in fish oil supplements, can also increase the risk of bleeding when used with heparin. Drug food. It is also important to be aware of the drug-food interactions of heparin, as some foods can interact with heparin and affect its effectiveness. Some of the foods that can interact with heparin include 1. Vitamin K-rich foods. Vitamin K is a nutrient that helps the blood to clot. Foods that are rich in vitamin K, such as leafy green vegetables, can reduce the effectiveness of heparin. 2. Alcohol. Alcohol can thin the blood and increase the risk of bleeding. When used with heparin, alcohol can increase the risk of bleeding and other potential complications. 3. Grapefruit. Grapefruit contains compounds that can interfere with the breakdown of certain medications, including heparin. This can lead to higher levels of heparin in the bloodstream and increase the risk of bleeding. Common side effects of heparin. While heparin can be an effective medication for preventing blood clots, it can also have side effects. Some of the common side effects of heparin include bruising or bleeding at the injection site, mild allergic reactions such as rash, itching, or hives, nausea or vomiting, hair loss. Serious side effects of heparin. In addition to the common side effects, heparin can also have more serious adverse effects. Some of the adverse effects of heparin include 1. Thrombocytopenia, a condition where the blood has a lower than normal number of platelets, which can lead to an increased risk of bleeding. 2. Hemorrhage. Excessive bleeding can occur, especially if the dose of heparin is too high. 3. Osteoporosis. Long-term use of heparin can cause bone loss, leading to osteoporosis. Administration considerations. Available forms. Solution for injection. Heparin is available as sodium or calcium heparin. 4 bolus, 5,000 to 10,000 units ml. Subcutaneous injection, 25,000 units ml. Absorption, fate and excretion. Heparin is ineffective orally. It is well absorbed after subcutaneous injection. On 4 injection, it produces immediate anticoagulant effect. It should not be used intramuscularly because it produces hematoma. Heparin does not cross placental barrier. Also, it is not secreted in milk. It is metabolized in the liver by an enzyme called heparinase. It is eliminated in urine both in an inactive and a metabolized form. Substitutes of heparin. Low molecular weight heparins, LMWHs. Examples: enoxaparin, dalteparin, tinzaparin. Fondaparinux. Direct oral anticoagulants, DOACs. Examples: rivaroxaban, apixaban, edoxaban. Warfarin, vitamin K antagonist. Antidote of heparin toxicity. Antidote of heparin toxicity is protamine sulfate. Monitor of heparin. The APTT is used to monitor the effectiveness of anticoagulation with unfractionated heparin and direct thrombin inhibitors. See subsequent material. The normal range is 20 to 35 seconds, but values vary slightly among laboratories. The therapeutic range for systemic heparinization is 50 to 80 seconds. Thank you very much for visiting Nursing with Binod Sir YouTube channel. If you are new viewer, subscribe, like and share this YouTube channel to your friend circle. Stay in touch with this channel for more MCQ.